Hi, I'm Abigail, and this is my skin model project. So on the first side, I have the hair and hair follicle, and the hair follicle is the cavity from which the hair grows from. And hair is an accessory organ made up of dead proteins and hard keratin. Also attached to the hair follicle is the sebaceous gland, which is responsible for secreting sebum. And then also attached to the hair follicle is the erector pili muscle, which is bundles of muscle fiber that make goosebumps. And then also on this side, we have the veins and arteries, which carry blood to and from the heart. And I think that's all for this side. And then on the second side, we have the sweat gland, which is the gland from which sweat is secreted through. And sweat is responsible for regulating body temperature. And then also we have the sweat gland duct, which is the passage from which sweat goes through when it's being secreted. And then we have the epidermis, which is the outermost layer of the skin, and it's made up of keratin, and it also lines inner organs or internal organs. And then we have the tactile corpuscle, which is the nerve endings that are responsible for processing touch. And then we have the middle layer of skin, the dermis, so like all the pink, which is below the epidermis and contains the hair follicles and sebaceous glands that again secrete sebum. And then we also have the nerve endings, which are responsible for processing stimuli like pain and temperature. And lastly, we have the subcutaneous and hypodermis level of the skin, which is the deepest level of skin, and it contains lipocytes, which store fat, and it also connects your skin to your muscles. And then for my disease, I got basal cell carcinoma, and its signs and symptoms can appear on sun-exposed skin as red swollen bump, white and waxy, or a brown and scaly patch or bump on the surface of the skin, and it can also cause loss of skin color. Treatment can be removal through surgery or treated by the use of prescribed topical creams. And then diagnostic tests and procedures. The doctor can detect it through a skin examination or with a biopsy. And its prognosis is it may become invasive and can result in damage to the skin and bones if left untreated. And then my burning question was, how do scars form? And I said, scars are caused after damage is done to the layers of skin. Depending on how deep the injury goes, results in how bad the scar will be. Typically, small cuts or lacerations will only leave a very faint scar or maybe no scar at all. Deep cuts or lacerations that go beyond the dermis can result in thick raised scars known as keloids. Scars form due to the wound disrupting the ECM, which is the extracellular matrix that contains nutrients and collagen. The wound causes a break in the ECM pattern and makes a new one in one same direction. The new tissue contains a higher level of ECM, making it more sensitive and fragile. Because there's now more collagen, which is secreted by fibroblast cells at the site of the wound, the new skin won't be able to function like the original skin. Scar tissue is unable to produce sweat and can't grow hair. Typically, the new skin will also be more sensitive to temperature and won't be able to regulate body temperature as easily. To help a scar heal to its greatest potential, it should be kept in a wet environment. Fibrosis is the presence of excessive fibrous connective tissue that causes scarring on internal organs. The new tissue that is made after a scar becomes inferior to the original tissue. Depending on which organ has fibrosis determines on how bad the effects will be. A heart attack victim might experience pulmonary fibrosis, which is ECM buildup on the heart that can make beating hard for the heart. And that's all.